You take your medication exactly as prescribed, the same bottle on your nightstand every night. And right now, it might be quietly draining the brain chemical your memory depends on. Maybe it is the antihistamine you take to fall asleep, the pill for your bladder, or the one for your anxiety. Here is what most doctors rarely explain. Several common prescriptions after 60 block acetylcholine, the chemical your brain uses to hold on to memories. And the effect does not reset between pills, it adds up. My name is Liam Green, and this channel helps people over 60 understand what the research actually says in plain language. Today, I am walking you through 5 medications that quietly interfere with memory after 60. Stay through all 5 because number 3 might surprise you, even researchers are still split on it. And number 1 matters most because it is often prescribed off-label for something it was never actually designed to treat. One concept first, because without it, nothing else will fully make sense. I call it the memory budget. In your 30s and 40s, your brain produces plenty of acetylcholine, so an occasional pill barely registers. But after 60, 3 things change. First, the cells that make acetylcholine naturally decline, so your reserve shrinks. Second, every medication that blocks it drains a little more from that smaller reserve. Third, those drains add up across every medication you take at once. Doctors call medications that do this anticholinergic, which simply means it drains acetylcholine. You will hear it again today. That is the memory budget, the lens for everything that follows. Quick question, how many medications are you currently taking? Drop the number below, it might help someone else watching. Medication number 5, diphenhydramine, the active ingredient in Benadryl. Let me tell you about Carol, 67, a retired schoolteacher in Tampa who has taken Benadryl most nights for 20 years, first for allergies, then for sleep. Last year, her daughter asked the same question 3 times in one call. Carol did not remember asking it before. Here is the problem. It sounds completely harmless, sold right on the shelf. Here is the problem. It is one of the strongest anticholinergics available. And here is where it gets even more counterintuitive. Taking it nightly for sleep means your brain never gets a night off from that drain. The American Geriatric Society says older adults should avoid it. A 2015 study in JAMA Internal Medicine tracked more than 3,400 adults for 10 years. People who used the most of these medications had a 54% higher risk of dementia. Instead, ask about second-generation antihistamines like loratadine or cetirizine, same relief without crossing into the brain the same way. Medication number 4. Oxybutynin, sold as ditropan for overactive bladder. Let me tell you about Frank, 72, a retired accountant in Portland who started oxybutynin after one too many bathroom emergencies. It worked. But Frank also started losing his train of thought mid-sentence. Here is the problem, it sounds purely local. Here is the problem, oxybutynin is fat-soluble, so it crosses into the brain and blocks the same memory receptors. And here is where it gets even more counterintuitive. Of all the bladder medications, oxybutynin is the worst offender. Newer options barely cross into the brain. A 12-year study followed bladder medication patients. The highest exposure group had a 40% higher dementia risk than the lowest. Instead, ask about mirabegron, sold as Myrbetriq. It works through a different pathway, and trials testing cognitive function found no difference from placebo. Medication number 3. Benzodiazepines. Like diazepam, sold as Valium, or lorazepam, sold as Ativan for anxiety or sleep. Let me tell you about Diane, 65, a former nurse in Columbus, prescribed lorazepam after her husband passed away. 5 years later, she still takes it nightly and avoids family gatherings, embarrassed by losing the thread. Here is the problem. Benzodiazepines do not block acetylcholine like the others on this list. Here is the problem anyway. The research on dementia risk is genuinely split, and I would rather be honest about that. And here is where it gets even more counterintuitive. Even studies that found no dementia link still found real, measurable harm to memory and attention while people are taking them. A 2014 study in the British Medical Journal found a 43 to 51% higher risk of Alzheimer's linked to past use. But a separate study, also in the British Medical Journal, found no extra risk at the highest levels of use. Instead, for sleep, cognitive behavioral therapy has outperformed medication in head-to-head trials. For anxiety, ask about non-benzodiazepine options first. If you are still with me, type 5 in the comments. It tells me this is landing and helps this reach someone who needs it. Medication number 2, paroxetine, sold as Paxil for depression and anxiety. Let me tell you about Robert, 70, a retired postal worker in Albuquerque who started Paxil 8 years ago. It helped lift his depression. But his daughter noticed something else. Robert repeats stories he told her the week before, with no memory of telling them. Here is the problem. Paroxetine belongs to the same family as some of the safest antidepressants available, SSRIs. Here is the problem. It has far stronger anticholinergic activity than the rest of that family. And here is where it gets even more counterintuitive. Other SSRIs in this research were not linked to higher dementia risk. It was specifically paroxetine that stood out. A 2018 study in the Journal of the American Geriatric Society followed more than 3,000 adults for 8 years. People taking paroxetine had up to twice the risk of dementia compared to people taking none at all. That held even after researchers accounted for anxiety and stroke risk. Instead, ask about sertraline or escitalopram by name. SSR is without that anticholinergic activity. And medication number 1. Off-label antipsychotics like quetiapine sold as seroquel. Let me tell you about Eleanor, 74, a retired librarian in Halifax prescribed seroquel by her family doctor, not for psychosis, but to help her sleep after months of insomnia. Nobody explained this was a powerful antipsychotic used outside its intended purpose. Here is the problem. Quetiapine seems gentle in low doses, sedating, easy to prescribe. Here is the problem. It is a strong anticholinergic, never well tested for insomnia in older adults. And here is where it gets even more counterintuitive. This is the most overlooked danger in medication management after 60, not the drug itself, but not knowing it was designed for something else entirely. In 2005, the FDA issued its strongest possible warning. A review of 17 trials found these drugs raised the risk of death by 60 to 70% in people with dementia. Other research links long-term use of quetiapine to a real decline in thinking ability. If you or someone you love was prescribed an antipsychotic for sleep rather than psychosis, that deserves a direct conversation with the doctor about why. Here is something useful in 5 steps. Step 1. List everything you take, including over-the-counter products. Step 2. Ask your doctor or pharmacist directly, does anything here carry anticholinergic risk? That phrase gets a different answer than asking if something is safe. Step 3. Never stop a medication on your own, especially benzodiazepines or antipsychotics. Any change needs to happen gradually, with medical guidance. Step 4. Ask specifically about the alternatives we covered today by name. Step 5. If you are a caregiver, run this same review for the person you care for. None of this means you did something wrong. The goal today is not fear, it is one conversation at your next appointment you might not otherwise have had.